Welcome to another production by the Millennial Mechanical Therapist. Your hosts, Dr. Joseph Gravino and Dr. Clay Case, are two physical therapists trying to treat health issues mechanically. Listen further for patient cases, guest videos, advantages and disadvantages of the way they practice, and much more. Thanks for tuning in today. Check us out on YouTube, Facebook, and at our website. We hope that you learn a lot from watching this video and you come back for more.
Hello everybody, I am the Millennial Mechanical Therapist, and today we're going to talk about the fear of flexion. I had a patient who came in, younger gentleman, and with severe central low back pain. Came in with his mom. His mom worked in a chiropractor's office, and who apparently did a little bit more traditional chiropractic work. And he was going to this chiropractor for about a year and getting worse. Mom was worried, so she got him an MRI from the family care practitioner, and then brought him to our clinic. And I think it was just about time. Who knows? We'll get into the case a little bit more. So, as a 17-year-old male who was quite athletic looking, you would think he'd be very macho, or, have a little bit more, swagger to him, so to speak. Yet he was very timid, very kind of down, and, walked in, not a great handshake. Who knows if that was him all the time, but he just didn't look happy. Moral story, didn't look happy. So we're talking through it. He's, sitting on my table in, the worst posture in the world. And here's my mind thinking he's probably, he's younger, he's probably got a posterior derangement type thing, horrible posture. So we're talking, and he's telling me that about a year ago, he started getting back pain. It's been progressively getting worse. And he keeps mentioning that he refuses to bend forward, can't tie his shoes, can't stretch, can't anything, fill in anything where it's forward bending. And he keeps coming back to it, And he's telling me that he went to the chiropractor that his mom worked for a couple times, and things just got worse, and he definitely wanted to stop because he was laid up in bed the next day after every single session, which is unfortunate. Not to put down our chiropractic friends. I think the power of manipulation is wonderful, but I think if you know a little bit about us now, you'll know that truly patient empowerment, patient-generated forces come first, in my mind, regardless. Can you manipulate? Yes. Should you manipulate? Up to you. Moving on. So, he sounds purely like a derangement when he comes in. But then again, he also sounds a little bit like a dysfunction, scratch that. Purely like derangement. Everything is variable. He refuses to bend, so he won't tell me about bending, but sitting sometimes makes his symptoms worse, sometimes make it better. Rising from sitting usually makes things worse. Standing sometimes makes things worse, sometimes makes things better. Walking sometimes makes things worse, sometimes makes things better. So on, so on, so on, so on. He also mentioned specifically if he's sitting and lifts his leg, it definitely makes things worse. I think we all know what that is. No red flags, get that all out of the history. We go through, we look at posture. Posture does nothing to him whatsoever. Positive SLR. He told us that, but it was. Reflexes don't look bad at all. Myotomes don't look bad at all. Nothing. Neuro seems fine. He has no numbness and tingling, nothing like that. So, we look at range of motion, and I make him go through everything besides forward flexion. Everything looks, in all intents and purposes, completely normal, totally fine. When I asked him to bend forward, he really looked fearful. I said, listen, just do it once for me, let's see what happens. So, super limited in forward flexion. Whether, I'm thinking, is this just he's afraid? But he's telling me he bends down, his fingertips can't even touch his knees, and he says to me, I ask him, what do you feel when you're there? Is it just you won't go any further because you're afraid? Do you feel pain? What do you feel? He says, I feel pain, but I feel like I physically can't go past this. Right? Like, physically can't go past this. In my mind, he said, Joe, I have an obstruction to flexion. So we went forward. He wouldn't bend. I asked him if he would bend forward and standing. He said no. So we brought him to lying. And he, he explained that lying is a little bit less intense, and that he had to bring his knees to himself instead of himself to his feet or to his knees. Well, he felt a little bit more calm doing it. I helped him through it a couple times. He said it really doesn't hurt. He just feels some pulling at the very end. We went through a whole bunch of times. And when he stood up, although he really didn't feel anything, he said, out of the ordinary. There was no true effect of going through the motion. Afterwards, when he stood back up, the feeling of standing felt better. Again, though, his symptoms are variable, so who knows if it was just the variable nature. And him and his mother brought that up to me too. Take it with a grain of salt. We checked his forward flexion range of motion. He's past his knees now. We go back to lying. We do it again. He's well past his knees. He's getting a little excited about this because he feels better with moving. He said the feeling like I'm stuck is not really there anymore, or it seems farther as we keep going. So I brought him into sitting, maybe a little bit too aggressive. He loved it. He said he felt almost 100% better afterwards, like 99% better-ish, whatever. So he felt wonderful. And I explained to them everything we talked about, what it could be. We talked about a derangement versus the perceived threat type thought processes. They seemed like very anatomically and medically understanding individuals or knowledgeable individuals. So we had a little bit more time to talk because I didn't have to bring him in any other movements. Oh, by the way, straight leg raise negative afterwards. Wonderful, 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 wonderful. It was just huge. And the kid loved it. The kid literally was so afraid to bend forward, he could have figured out his own direction of preference if he was over his own fear. And I know, the literature out there talks so much about fear avoidance, things like that in the low back pain population. And it's true. I mean, if you see a lot of people with back and neck or spinal issues, any issues, but truly back and neck, I feel like these people have a little bit more of a psychological piece to it as well. They're in a lot of pain and they're afraid to move, and they learn, unfortunately, through painful stimuli that sometimes movement can equal harm, or they think that. And in this guy's case, moving to the harmful position, albeit we had to take him unloaded versus him being in a loaded standing position, was exactly what he needed. And that's awesome. That's beautiful. And it showed him that, yes, he can bend. He's a teenager. Of course he can bend. There's nothing wrong. He went through. He's going to be fine. I mean, that's amazing. And when I saw him on subsequent visits, he was just loving life. He went back to playing sports. He went back to doing it right, in the middle of treatment. He said, hey, when I play sports, it gets a little aggravated, but I do the exercise, it all goes away, blah, 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 blah. And we kept going. Within a week or so, he was wonderful, and he never wanted to come back again. And of course he did. And, we set him off good for the future and whatnot. But, I mean, how amazing is that? Young kid who, on day one, looked totally different in the beginning of the eval versus after the eval. He looked like an individual who's been beaten down, had a hard, rough life. And then all of a sudden, we gave this teenager his ability to be a teenager again. I mean, that's awesome. And I'm not going to say it's the assessment. I'm not going to say it's the system. I'm just going to say it was listening and looking. Listening and looking. I could have easily looked at this kid and given him anything. You know what I mean? I could have given him just gentle stretches. It looked like he had tight hamstrings. You know what I mean? Like, I could have given him anything. He already went through chiropractic and went wrong. Some people would take that as a bad thing. Just move them. Move your patients. Show them that it's okay to move. We're meant to move. Movement does not equal harm. I think we're starting to understand that as our profession moves more towards the pain science talks, more of the, the central nervous system, peripheral nervous system, and how they're influencing the way that we feel pain, the way we perceive pain and threats, and which is wonderful. I think if you haven't heard my standpoint, I always believe that we should mash everything together. Yes, back in the day, everyone was so talking about pathoanatomical situations. Now we're getting so far away from that. Maybe there's a nice happy medium, whatever. We won't talk about that. You'll hear that on other videos. This kid lost his fear by having the courage of someone helping him move. It's beautiful. Doesn't need to be me. There's plenty of people out there doing it. Just move your patience. On that, I'll leave you guys. Have another good day. find us on YouTube. Subscribe to us if you can. Look for us on Facebook. Like the Facebook page. Go to our website because there's definitely research articles up there. We're trying to post more of those. Post some of these evaluation forms as long as we can. And many other things if we can, videos from the Institute, videos from things that are being seen all around the world that we're finding. People are posting these types of things, which is beautiful, wonderful. Love sharing this information. Hope you guys are learning. Please leave us some comments. Let us know what you'd want to see, if there's any questions you guys have. We'd love to see if we have anything to bring or shed some light, how MDT or patient response would attack said situation. Please, would love to hear from you. Hope everyone's doing good. Stay tuned because we got more for you. All right, move your patients early, move them often, and move them to end range, my friends, because that's where the magic happens. See you next time.